Many women today are being told by doctors that they need to undergo surgery, sometimes even to remove their womb, to treat reproductive health issues like endometriosis. It's heartbreaking because our bodies were not created for that. God didn't intend for us to lose our wombs. He said, "Be fruitful and multiply." God created us with the ability to bring life into the world. But so often, before even exploring other options or natural treatments, we're quick to follow the doctor's advice and opt for surgery, even at a young age. The truth is, there are other paths to healing, but many of us don't want to put in the work. Healing requires effort, and we must stop being complacent with our health. I encourage every woman listening to take control of her health, take control of her life. Start the journey to getting truly healthy. No one else can do the work for you. You have to do it for yourself. I want to speak life and healing over you today. Every woman out there struggling with endometriosis, I see you. Feeling lost, confused, or unsure of which path to take? I understand the pain you're going through. I want to take a moment to acknowledge just how hard this battle can be. I want you to know that you're not alone. Endometriosis is not easy. It's exhausting. It's painful, and it can feel like an endless fight. I know because I've been there. I've been in those moments when the pain was so unbearable that I thought I wasn't going to make it. There were days when it felt like my body was failing me. I was overwhelmed with frustration and confusion. I understand how overwhelming it can feel when you're given limited options, none of which feel right for you. But here's what I've learned. There is more than one way to heal. While surgery or birth control may work for some, they aren't the only options. Your body has the ability to heal when given the right tools, and I'm living proof of that. Your body is capable of incredible things, even in the face of such a difficult diagnosis. There is hope. And I believe that with the right tools, mindset, and self-care, your body can heal and recover. If you're facing a diagnosis like endometriosis, take the time to explore natural, holistic alternatives. Listen to your body and trust that there are other paths to healing. It may take time and patience, but by making intentional lifestyle changes like shifting your diet and reducing exposure to harmful chemicals, you can support your body in its journey to wellness. Welcome to my channel. For those of you who are new, I am Shanika, a mother, entrepreneur, master herbalist, and an author. My personal battle with endometriosis and ovarian cysts led me to a plant-based vegan diet and holistic practices, resulting in remarkable healing. This channel is dedicated to helping you achieve and maintain health naturally, with tips on reversing diseases to my own experiences and herbal remedy. Join me in discovering how to live a healthier, happier life. Endometriosis is a chronic condition in which tissues similar to the lining inside the uterus, called endometrium, grows outside the uterus. It primarily affects women of reproductive age and can cause severe pain and a range of other symptoms. Here are some key information about endometriosis. The specific cause of endometriosis is not entirely clear, but some theories suggest it could be related to genetic factors, immune system disorder, or hormonal imbalances. Endometriosis, like other reproductive diseases, is often influenced by the lifestyle we lead and how we care for our bodies. It doesn't start in adulthood. Nothing happens overnight. While genetics can play a role, that doesn't mean that just because a family member suffered from a particular condition, we are destined to follow the same path. It all comes down to how we take care of ourselves. In my book, Taking My Health Back, I discuss this very point about genetics. We often hear people say, it's because of genetics, but I believe that this idea is overused. It's less about genetics and more about the environment we create for ourselves. If your father ate poorly and lived an unhealthy lifestyle, and you grow up doing the same, it's likely you experience the same health issues. However, if you choose to live differently, eat differently, and care for your body, your outcome can be different. The same applies to reproductive diseases. While genetics may play a small role, by making different lifestyle choices, we can get different results. Additionally, it's important to understand that not everything is genetic. Every person's body is different. Some people may become sick faster, while others, illness may not manifest until much later in life, when it may be harder to reverse. Symptoms. Pelvic pain is the most common symptom, often related to the menstrual cycle, but it can occur at other times. Many women with endometriosis experience pain during or after intercourse. Painful period pain is typically more intense than normal menstrual cramps. Some women experience heavy periods or bleeding between periods. Endometriosis can be associated with difficulties in conceiving, affecting up to 50% of women with the condition. Other symptoms include bleeding during or after sex, digestive issues, lower back pain, fatigue, diarrhea, constipation, bloating, nausea, and painful urination or bowel movements, particularly during menstruation. While these are common symptoms, some women with endometriosis may experience little to no symptoms, and the severity of the symptoms doesn't always correspond to the severity of the condition. If you are experiencing any of these signs or suspect you might have endometriosis, it's essential to consult a healthcare provider for proper diagnosis. Endometriosis is categorized into 4 stages: minimal, mild, moderate, and severe, depending on the extent, depth, and location of the endometrial tissues, as well as the presence of scar tissues and adhesions. Minimal and mild stages involve small lesions or shallow implants. Moderate and severe stages involve deeper implants, large cysts on the ovaries, and extensive scar tissues. Endometriosis can interfere with reproductive organs, leading to infertility. It may cause blockages in the fallopian tubes or affect the quality of the eggs. All women with endometriosis face infertility. It is a common concern for those with moderate to severe stages. When it comes to treatment options for endometriosis, doctors typically recommend things like surgery, hormonal therapy, or even birth control to manage the symptoms. While these treatments can provide temporary relief, it's important to understand that they do not reverse the disease. Surgery may remove some of the tissues, and medications might reduce the pain for a while, but they are not addressing the root cause of the condition. These treatments are commonly offered because they align with conventional medications approach to symptom management. However, they are not designed to heal the body or promote long-term wellness. That's where holistic healing comes in. Holistic approaches focus on healing the body from within, addressing the underlying causes like inflammation, hormonal imbalances, and lifestyle choices. By changing your diet, detoxifying the body, and reducing exposure to toxin, you can work towards not just managing but actually reversing endometriosis. While doctors may recommend surgery or medication, remember that these are not your only options. You can choose a more natural and holistic path to healing that focuses on long-term health rather than just temporary symptom relief. Holistic approaches to managing endometriosis. Anti-inflammatory diets, alkaline plant-based diets, and cutting out processed foods, sugars, and refined grains will reduce inflammation and manage symptoms. Herbs like ginger. Ginger shot is great. Cramp bark herb, castor oil, and others have been studied for their anti-inflammatory properties and can help reduce pain and swelling associated with endometriosis. Regular detox practices like colon cleansing and intermittent fasting, as I discuss in other videos, can help reduce the toxin burden on the body and promote overall health. And also liver detox. The liver plays a crucial role in metabolizing estrogen, so a gentle detox can help manage estrogen dominance. Supporting liver health with herbs like dandelion root and burdock root is essential. Chemicals can worsen hormonal imbalances. Switching to natural products for skincare, cleansing, and personal care is crucial. Chronic stress can worsen symptoms by increasing inflammation and hormonal imbalances. Practices like yoga, meditation, deep breathing, and prayer can reduce stress levels. For years, I suffered from the debilitating effects of endometriosis. The pain began subtly but soon became a constant part of my life, particularly during the menstrual cycle. What initially felt like intense cramps soon evolved into overwhelming discomfort that affected many aspects of my daily routine. Pelvic pain, painful periods, and fatigue were just the surface of what I endured. Even simple tasks like getting out of bed on bad days felt like monumental achievements. It wasn't just the physical pain that took a toll. Emotionally, it was draining. There were moments when the severity of the pain left me feeling powerless and frustrated. Heavy periods, difficulty with digestion, and hormonal imbalances became the norm. The emotional burden combined with the physical agony was incredibly difficult. Through it all, one of the biggest changes I made was transitioning to an alkaline plant-based vegan diet. At first, I wasn't sure how much impact this would have on my reproductive health, but I decided to embrace it fully. I started fasting, detoxing, and nourishing my body with whole alkaline foods that supported healing and detoxification. I cut out processed foods, sugar, and anything that triggered inflammation in my body. This transition wasn't just about food, it was a complete lifestyle overall. At first, the results weren't immediate. I saw positive changes in areas I didn't expect: clearer skin, better digestion, improved vision, and a sharper mind. But in terms of my reproductive health, the improvements came more slowly. However, I remained patient, trusting that my body needed time to heal from years of imbalance. One of the greatest lessons I've learned through this journey is that healing takes time, but it's possible when we approach it holistically. While it wasn't easy to make such dramatic changes to my diet and lifestyle, it was absolutely necessary. I also realized that I needed to reduce stress, practice mindfulness, and prioritize my emotional well-being. Emotions like stress, fear, and anger can contribute to health issues. And I began to see the importance of managing these emotions as part of my healing process. Although I understand that completely avoiding endocrine disruptors is nearly impossible in today's world, I've learned how to be intentional about limiting my exposure, finding balance, and avoiding extremes has been key to maintaining a healthy and sustainable lifestyle. Sticking to a plant-based vegan diet, at first I wasn't sure how much impact this would be on my reproductive health, but I decided to embrace it fully. As I close, I want to remind every woman out there that you are powerful and your body has the incredible ability to heal. Don't lose hope or feel like you're alone in this battle with endometriosis. You are not defined by this condition, and you don't have to accept what it tries to take from you. There are natural and holistic paths to healing, and I encourage you to explore them. Take control of your health, love yourself enough to do the work, and trust that your body can heal when given the right tools and care. Thank you for taking the time to watch my video. I'm here to walk this journey with you, and I believe in your ability to rise above this challenge. Stay encouraged, stay strong, and remember, you are not alone.